This talk is about development, more specifically about answering developmental questions. Developmental questions have very different wordings, but when boiled down, when they are translated to developmental jargon, they are of two general types: true or false questions. As you can see here, in true or false questions, the stem of the question usually consists of a single sentence with an age or an age equivalent and one or more milestones. The second general type of developmental question is multiple choice questions. Multiple choice questions based on the location of the milestone within the questions are further divided in two types: those with the milestones in the choice section of the question, as you can see here, and those with milestones in the stem section of the question, as you can see here, underlined with aqua. Regardless of the types, developmental questions are difficult to answer correctly. This is so mainly for three reasons. The first reason is that there are a huge number of different milestones accomplished at a given age. The second reason is that not all normal children achieve a given milestone at the same time. This point is well represented in the Denver Developmental Test, which gives us 4 markers for each milestone. Each of these markers indicate the percentage of kids accomplishing a given milestone at a given age. The beginning of the bar, where the milestone is written, indicates the age 25% of kids have accomplished the stated milestone. A line in the white segment of the bar indicates the age 50% of kids have accomplished the given milestone, where the bar changes color indicates the age 75% of kids have accomplished a given milestone, and the end of the bar indicates the age 90% of kids have accomplished the given milestone. This latest parameter is by far the most important because it is the one used to screen for developmental delay in clinical practice. The third reason developmental questions are difficult to answer correctly is the lack of agreement among authors as to the age that not having achieved a given milestone should be considered a factor in the diagnosis of developmental delay. I will give you one example. The milestone checklist put forward by the CDC states that pulling up to a stand is achieved by most infants by 12 months of age. Hence, using the CDC checklist, not being able to pull to a stand at 10 months of age would not be considered a factor towards the diagnosis of developmental delay. Whereas, Nelson Textbook of Pediatrics states that at 9 months, all normal infants are able to pull to stand. Hence, using this criteria, not being able to pull to stand at 10 months of age should be considered a factor towards the diagnosis of developmental delay. During this talk, I will attempt to remedy some of these difficulties by telling you about 3 steps that will increase your chances of answering a developmental question correctly. The first step is to memorize a few anchoring developmental milestones and to use them as nodal points to calculate the relative achievement age of other milestones. The second step is to use chronology. Chronology, from the developmental point of view, refers to an arrangement of developmental milestones in the order they are attained by most normal individuals. And the third step is to have a plan adept for each type and subtypes of developmental questions. So let's look at the first step, which, as we just mentioned, consists of memorizing a few anchoring developmental milestones. In Nelson Textbook of Pediatrics 20th edition, in the electronic version, you will find a very important table labeled 590-1. The title of this table is Screening Scheme for Developmental Delay, Upper Range. In the first column, the table provides the age in months. The other columns are labeled by areas of development. The second column lists developmental milestones in the gross motor area. The third column lists fine motor area milestones, referring to motor activity driven in large part by problem solving. The fourth column lists developmental milestones in the social skills area, which includes emotional milestones. And the fifth column lists developmental milestones in the language area, which include different forms of communication skills. This table probably can be used to answer the most frequently asked developmental question you will find in your exams. There are many tools to help you memorize the milestones in this table, but in my opinion, the easiest way to memorize them is a mixture of visual aids, organization, and repetition. So, based on these premises, I have drawn some cartoons organizing these milestones, and during the course of this talk, I will repeat them many times from different perspectives. At 3 months of age, the developmentally appropriate infant should, in the gross motor area, support his or her weight on the forearms. In the fine motor area, open hands spontaneously. In the social area, smile in response to a smile or to get the examiner's attention. In the language area, coo spontaneously or again to get the examiner's attention. In addition to cooing, at this age, infants should laugh. Interestingly, the CDC guidelines distinguish chuckles from laughter and describes chuckling as an activity that most babies do by 4 months and laughing as an activity that most babies do by 6 months. At 6 months of age, the developmentally appropriate infant should, in the gross motor area, sit momentarily with no support. In the fine motor area, transfer objects from one hand to the other. In the social area, show likes and dislikes by facial expression, not by crying. And in the language area, babbles. At 9 months of age, developmentally appropriate infant should, in the gross motor area, pull to standing. In the fine motor area, use pincer grasp. In the social area, play pat a cake and peekaboo. And in the language area, imitate sounds. At 12 months, the developmentally normal appropriate infant should, in the gross motor area, walk with one hand held. In the fine motor area, release object on command with or without gesture. In the social area, come when called. And in the language area, use 1 or 2 words in the correct context. At 18 months of age, the developmentally appropriate infant should, in the gross motor area, walk upstairs with one hand held. In the fine motor area, feed themselves with a spoon, but are still very messy. In the social area, mimic the actions of others. Some parents refer to this milestone as monkey see, monkey does. And in the language area, say at least 6 meaningful words. By 24 months of age, the developmentally appropriate child should, in the gross motor area, run. In the fine motor area, build a tower of 6 cubes. This is easily remembered by adding the absolute values of the months. 2 plus 4 is 6. In the social area, play with other children, and in the language area, make 2 or 3 word sentences. The milestones just listed constitute, as we will see, the nodal points that we will use in the course of this talk to chronologically arrange other milestones not so far mentioned. Now we will address the second step aimed at improving the chances of answering developmental questions correctly. That is the use of chronology. Chronology, from the developmental point of view, as we previously mentioned, refers to arranging developmental milestones in their order they are attained by most developmentally appropriate kids. The reason chronology is effective to help us answer developmental questions is because, as expressed in this frame, normal development results from normal nervous system maturation, which advances in an orderly fashion based on evolutionary principles dictated by the need of survival and procreation. Here goes an example that supports what we have just said. The motor response, a massive synchronous motor action, which we can see here being displayed by the baby monkey is vital for the survival of the newly born monkey. This is so because while the mother monkey is running away from a hungry tiger and the baby monkey falls from her, the mother monkey does not stop to pick up the baby monkey. Hence, the nervous system structure involved in the motor response, mainly those in the brainstem, spine, and peripheral nervous system, matures earlier than those for dancing. Dancing in some monkeys is a behavior related to mating. Dancing requires a high degree of coordination of isolated precise movements of specific motor groups that cannot start to develop until the motor reflex disappears, which is by about 5 or 6 months after birth in full-term neonates. The degree of motor coordination needed for dancing includes pyramidal tract maturation, mainly myelination, and cerebrocortical maturation, which include synaptogenesis and myelination. In the next few frames, I will illustrate in broad strokes pyramidal tract maturation, and in future frames show you the effect that such maturation has in gross and fine motor development in humans. Later in this talk, we will discuss the effect of cerebral maturation. The pyramidal tract, which starts in the cerebral cortex and extends all the way down to the caudal spinal cord, is not myelinated at birth. Myelination of this tract starts shortly after birth by involving the centrum semiovale, advances to the upper brainstem, lower brainstem, upper spinal cord, and lower spinal cord. It is this craniocaudal order of myelination of the pyramidal tract that to a great extent drives gross and fine motor development. In this frame, I have introduced the cartoon of a kid upside down. The aqua arrow introduced in this frame emphasizes the direction that maturation will be displayed. The red arrow just added indicates the passage of time. So eye movements are present in full-term neonates at birth. This is expressed by their ability to briefly regard and briefly follow human faces. Scanning the visual field in conjunction with recognition of species-specific facial features, a function likely mediated by the superior colliculi, since optic radiations are very immature at this age, are vital for survival. A baby monkey that fails to jump towards the mother and instead jumps towards a tiger is unlikely to survive. Shortly after eye control, the infant smiles. Notice that facial movements related to sucking and crying are present earlier than those related to smiling, despite being carried out by the same muscles. This is so because sucking and crying are vital for early survival. As pyramidal tract maturation reaches the cervical spinal cord and myelination reaches the anterior horn cells whose axons innervate the sternocleidomastoid muscle, the infant is able to turn the head from side to side at will. Notice that the head turning for survival triggered by rooting response is present at birth and gone by about 2 months of age. It is not until this reflex disappears that turning the head becomes a violational act. A little time after, the infant is able to hold the head straight. And then, when myelination of the pyramidal tract reaches the thoracic spine, the infant rolls over. If you recall, when we spoke about anchoring milestone, we said that at 3 months, as illustrated here, an infant should be able to hold the weight of its body using the forearms. This action is a prerequisite in conjunction with head control for rolling over. Also notice that the 3-month-old infant, whose hands at birth are fisted, are now open most of the time. This occurs as the result of myelination of the pyramidal tract reaching the spinal cord region destined to innervate the anterior horn cells whose axons form the brachial plexus. After rolling over, the developmentally normal infant is able to sit briefly. As you can see here, this usually occurs by 6 months, and it is also around this time that the infant transfers object from one hand to the other and vice versa. No side preference is expressed at this time. Hand preference is not normally developed until past 1 year of age. Coinciding with transferring, the infant starts to communicate likes and dislikes by facial expression other than crying. Shortly after, the infant creeps, that is an expression of progression of the pyramidal tract myelination to the lumbar spine. Further pyramidal tract myelination to the sacral spinal region allows the infant to pull up to standing from a sitting position. Hence, at this age, the infant, using his or her knees and arms, reaches the standing position. This milestone should already have been achieved by 9 months of age, but more importantly, for the chronologically arrangement of milestone is that it should occur after the infant sits by self, transfers, and creeps. Cruising comes next after pulling to standing. First, the infant cruises holding on to the same object and then venturing from one object to the other nearby object. After cruising, the infant starts walking with one hand held. Walking with hand held should be achieved by 12 months. Walking by self occurs shortly after. Myelination of the pyramidal tract also influences hand use. Hand maturation advances in two apparently simultaneous directions. In an ulnar radial direction, maturation in this direction leads to the initial similar use of the little finger and thumb. This peculiar maturational pattern probably follows evolutionary principles. Unlike humans, the monkeys use the small finger as well as they use the thumb. The second maturational direction for hand development is rostrocaudal, as would be predicted by the rostrocaudal advancement of the pyramidal tract myelination. This direction of maturation expresses itself by a willful use of the palmar muscles prior to the use of the finger muscles. These two forms of progression translate in the infant first having palmar grasp followed by mid-palmar grasp using the small finger and the thinner eminence, followed by root finger grasp, and finally by index and thumb grasp, which is usually achieved by 9 months of age and refers to as pincer's grasp, as illustrated here. So far, we have emphasized pyramidal tract maturation and not cerebral growth. But cerebral growth, especially synaptogenesis, which is the main factor contributing to the doubling of the human neonatal brain volume by 1 year, has the same or a stronger developmental impact than myelination. Currently, the prevalent theory about cerebral maturation proposes that cerebral maturation occurs simultaneously at distant cerebral regions based on functional needs to accomplish a given task rather than as it was once proposed by regional contiguity. Regardless of the correctness of either of these theories, nervous system maturation is a well-orchestrated event driven by genetic influence and by environmental factors. The orderly maturation of the nervous system affects all areas of development. We will first consider gross motor development. In this frame, you can see the progression of early gross motor development. The 3-month-old infant should support his or her weight using the forearms. The 6-month-old should sit without support. The 9-month-old should pull to standing and stand holding on. The 12-month-old should walk with hand held. By 18 months, the young child should be able to walk upstairs with one hand held. By 24 months, the young child should run and jump with both feet. So if you are asked at what age should a child be able to walk on his own, you can figure it out by remembering that by 12 months the infant should be able to walk holding on, and that by 18 months the child should be able to walk upstairs holding one hand. These two actions should help you deduce that walking by self should take place by 15 months. Recall that we are talking about the time that 90% of patients walk independently So obviously, most walk alone before 15 months of age. I give you another example. If you're asked when should an infant roll over, you can deduce that it will be between the time an infant is able to support his body with forearms and sit. So most infants turn by about 4 to 5 months. These two examples are instances where anchoring milestones are used as nodal points for determining other milestones. Gross motor development continues after 2 years of age, as you know, and as before, it does so in a predictable fashion. By 30 months, the child walks upstairs by self. At 36 months, that is at 3 years of age, the child should pedal a tricycle and stand on one foot. 4 years of age is a big year for gross motor developmental milestones. The child hops on one foot to celebrate that 1 year before, that is at 36 months, he was able to stand on one foot. At 4 years old, the child should also be able to throw a ball overhead as it is done in soccer. And at this age, the child is able to climb trees. By 5 years of age, the child jumps alternating feet. He uses this just acquired ability and other social and language developmental skills to play hopscotch. After gross motor development, we will consider fine motor development. And to do so, we will use the hand month clock. Handiness is the cardinal feature of fine motor development. A good place to start describing hand development is birth. At birth, the full-term newborn, as you can see in this photograph, has a well-developed palmar grasp reflex. The palmar grasp reflex is first noted at 28 weeks and fully developed at 32 weeks postmenstrual age. The palmar grasp reflex disappears by 2 to 3 months postnatal age, at about 48 to 52 weeks postmenstrual age. Hence, at birth and during the first month of life, the hand is fisted, regardless of you touching or not touching the infant's palm. But touching it triggers a stronger finger contraction of the hand than not touching it. By 2 months, placing a cube of the appropriate size in the palm still triggers fisting. The eyes at this age will not deviate towards this action. By 3 months, the palmar grasp reflex is gone, as we previously mentioned, and the infant now has the hands open most of the time. Recall that at this age, the infant uses his forearms to support his body, an activity easier to accomplish if you can use the palm of your hands to push against the ground. Other milestones acquired at this age is smiling spontaneously and to get the attention of the examiner. Cooing and laughing is also obtained at 3 months of age. The infant at this age is also able to look towards the sound and turns the head to the opposite side when the origin of the sound is changed, as you can see in these frames. This action may be mediated through the inferior colliculi and its connections, since auditory radiations are not fully myelinated at this age. By 4 months, the infant holds hands together, wringing them as if playing with them, and starts looking at them. If an object is introduced near the infant's visual field, the infant will look at it, but if covered, the infant will quickly turn the visual axis elsewhere. We refer to this occurrence as lacking the concept of object permanency. In other words, at this age, what is not viewed does not exist. Playing with his hands usually occurs at the same time as the infant rolls over. Rolling over, back to front, is not a reliable milestone because currently babies are placed on their back to sleep to avoid sudden infant death. Hence, front to back rolling may not be noticed till later. Shortly after, at 5 months of age, the infant starts picking objects from the ground, holding them for a while and then releasing them. It is at this time that the infant starts playing with his feet and looking at them. You get the impression that the infant is, at the end stage of mapping their own bodies, a process that starts by wringing and viewing their hands at about 4 months of age. At 6 months, the infant is grabbing objects using the palm of the hand and little finger, as we previously mentioned. And although the grab is not perfect, it is good enough to transfer objects from one hand to the other. At this age, the infant sits without support, shows likes and dislikes by facial expression other than crying, and characteristically, while sitting down on his own, as we have just mentioned, transfer objects from one hand to the other, as you can see here. In addition, the infant babbles. The tonic neck reflex that was present at birth disappears at this age. So does the Babinski reflex in many cases, although some authorities believe that the Babinski may persist and even be asymmetrical up until 1 year of age. But more importantly, the parachute reflex appears at this age as a preparatory safety reflex. Spreading the fingers and extending the arms, the parachute reflex is a good way to prevent head injuries that otherwise would occur as a consequence of frequent falls that usually occur as the infant starts attempting to stand up, cruise, and walk. So, after sitting, transferring, showing likes and dislikes not by crying and babbling, by 7 months, hand grab improves. By 8 months, releasing object is often accompanied with a look of satisfaction in the infant face as the object falls to the ground, and it is also at this age that they start pointing to objects. Next, at 9 months of age, a neat pincer grasp appears using thumb and index finger. The infant also starts getting 2 objects at a time and changes the field of vision from one object to the other as he transfers them from one side to the other side. They get up from sitting position holding on and often pull an object with them as shown here. Also, at this time, an important milestone is reached related to vision. If presented with an object in the visual field that attracts the infant's attention and then the object is covered, the infant continues to look at it. We call this phenomenon achieving object permanency. Object permanency indicates that the infant has realized that just because something is out of sight does not mean that it's not there. It's then that they start playing peekaboo and pat a cake. Next, by about 10 months of age, they start picking up small objects using very neat pincer and grasp. By 11 months, the pincer grasp is perfect using just the thumb and the index fingers with significant dexterity, and hand visual coordination is good. By 12 months, they drop objects on request, walk holding on, and about 75% of infants walk by themselves. In this new frame, you can see a bar compartmentalized by numbers representing ages in months. I will use it to continue representing fine motor developmental milestones after infancy. At 15 months, given a crayon, the child will draw up and down lines. Given cubes, the child will stack 2 and will use pincer grasp to drop pebbles in a bottle. By 18 months, the child will make longer lines in one direction, up and down, and lines with changing directions and loops. The child will stack 3 cubes, drop pebbles from bottles, and use a spoon to feed themselves. At 2 years old, the child will draw horizontal lines, make loops, stack 6 cubes. This is easy to remember, as we previously mentioned, by adding the numbers of months, as you can see here. By 30 months, the child will draw horizontal and vertical lines, make loops, often closing them, and stack 8 cubes. By 36 months, the child copies a circle, a fact that I remember by linking it to the wheels of a tricycle. Riding a tricycle, as you know, is also accomplished by 3 years of age. The 3-year-old child likes crossing lines and is able to stack 9 cubes, again just add the numbers of months as you can see here to remember the numbers. In addition, the child is able to make 3 cube bridges. By 48 months, the child copies a square and a cross, draws a simple figure of a man, and makes 5 cube bridges. The child is also able to choose the longest of 2 lines. By 60 months, that is by 5 years of age, the child draws a triangle and can pick up the heaviest of 2 objects. After considering fine motor development, we will consider social skills. The time of acquisition of social skills is easier to remember by dividing them in 3 categories. Those related to social development, play development, and fears. I will first address order of acquisition of social development. In this frame, you can see social development from 3 to 18 months, as it was initially presented in the anchoring milestones. At 3 months, the infant should smile spontaneously and in response to another person. It is interesting how early they understand the value of a smile. At 6 months, the infant shows likes and dislikes by facial expression other than crying. At 9 months, the infant plays peekaboo and pat a cake. At 12 months, the infant follows simple commands like dropping objects. And at 18 months, the child becomes a great imitator. After social skill development, we will address play developmental milestones. By 4 months, infants amuse themselves by playing first with their hands and then with their feet. At 9 months, they play peekaboo and pat a cake with adults. By 18 months, we can see the beginning of the process of symbolic thought, that is acting out using their imagination, like drinking from an imaginary cup or making a doll walk. They also start using tools as expressed by using a stick to bring objects close to them. In addition, at this age, as they did before, they prefer playing with adults. Yet by 24 months, the child prefers to play with other children. After play development, we will consider fears. In this frame, you can see a line representing time from birth to over 12 years of age. Loss of support and loud noises produces fear since birth and usually stops producing fear by about 2 years of age. Fear to stranger and height starts at about 6 months of age and usually also disappears by 2 years of age. Fear of separation, usually referred to as separation anxiety, starts by 6 months of age and disappears by about 6 years. Separation anxiety is especially important as a cause of sleep problems. At this age, which as you can imagine is not resolved by putting a light in the room, as it is often tried by uninformed parents. Fear to animals and masks starts at 2 years of age and usually disappears by 6 years of age. Fear of darkness usually presents at 2 years of age and may persist till 12 years of age. Fear of darkness is also a cause of sleep problems in children, but unlike sleep problems triggered by separation anxiety, it starts at 2 years of age and is resolved by putting a light in the room. Fear of body harm is not present before about 5 years of age and continues being present for the rest of our lives. Fear brought about by fantastic imagination such as ghosts does not start until 5 years of age and usually disappears by 8 years of age. Media events produce fears usually after 7 years of age. Fear regarding taking tests usually starts by 9 years of age. The possibility of dying also produces fears at about 9 years of age. Children before 12 years of age are very good actors because they have no fear of social performance. Fear related to sexuality appears at the age of 12. After social skills, we will consider language. At 3 months, the infant coos and laughs. At 6 months, the infant babbles. At 9 months, the infant repeats 2-syllable sounds. At 12 months, the infant says 2 words clearly and uses them appropriately. At 18 months, the child says about 6 words clearly and uses them appropriately. I will use this table to further explain language development. As you can see, down in the frame, the red line represents time from 9 months to 5 years. The ascending interrupted line indicates the progress of language development during this time. The bar just introduced is designated after the bar used in Denver Developmental Screening Test to indicate the number of individuals achieving a given milestone, as we explained earlier in this talk. The arrow indicates 50%. That is the time that 50% of individuals should have achieved a given milestone. So I have now introduced the number of words that 50% of children should be able to say and precisely use at different ages. From about 12 to 15 months of age, half of the children should be able to precisely use 4 to 6 words. From about 15 to 18 months of age, half of the children should be able to say and precisely use 10 to 15 words. From age 8 to 24 months of age, half the children should be able to say and precisely use 50 to 100 words. By 3 years, about 900 words. By 5 years, over 2,000 words. Children growing in the United States exposed to English and Spanish languages will start speaking English by about 16 months of age. That is later than children raised in monolingual English-speaking environment, and may mix languages at this age. But English word acquisition will be faster, and by 24 to 36 months, the number of English words children raised in bilingual and monolingual environments will be equal. Language segregation will also be appropriately consistent from 24 to 36 months of age, so that by 3 years of age, their English, that is the English of those exposed to 2 languages, is in par with those exposed to only 1 language. Another aspect of language development we should consider is the number of words in a sentence spoken by children at different ages. This is easy to remember. As you can see in this frame, 2-word sentences are used by 2 years, 3 by 3 years, 4 by 4 years, and 5 by 5 years. This frame illustrates some of the important accomplishments of 5-year-old children. As you can recall, in the gross motor area, they are able to play hopscotch by jumping on alternative feet guided by numbers, which they can identify and count up to 10. They can also identify and name at least 4 colors, draw a triangle, and choose the heaviest of 2 objects as well as the longest of 2 lines. At this age, children should be able to engage in simple adult conversation. With this brief summary of the achievement of a 5-year-old, I will end the second section of this talk about chronology. Now I will start with the third and last step aimed at improving the chances of choosing the correct answer when faced with developmental questions, that is planning. As you recall, early on in this talk, we said that there were 3 types of developmental questions: true and false questions, multiple choice questions with milestones in the stem of the question, and multiple choice questions with the milestones in the choice section of the question. We will address this type of question first. Here you have an example of this type of question. The first step to increase the chances of answering this question correctly is to arrange each milestone according to the appropriate developmental area. The first milestone and the first choice is transfer a cube. So, transferring a cube is a fine motor area milestone. The second option is drawing a line with a crayon. Drawing a line with a crayon is also a fine motor milestone. The third option is use pincer grasp. Using pincer grasp is also a fine motor milestone. And the fourth option is open hand spontaneously. Opening hand spontaneously is also a fine motor developmental milestone. This being the case, that is, all milestones being in the same area of development, the next step is to look at the stem of the question to decide whether we need to look for the easiest to perform action if the question is about what the patient should be able to do, or the hardest to do action or milestone if the question is about what the patient is unable to do. So you look at the stem of the question. The question is about what the child should be able to do. This is so because you found the word able with no exception in the stem. So the right choice is the easiest action. We then take the first option, that is option A, and ask ourselves what is easier, to transfer a cube or to draw a line with a crayon. I hope you remember or be able to figure out by simple deduction that transferring a cube is easier than writing with a crayon. Hence B is not the answer. Then you make the same consideration using pincer grasp. Again, using pincer grasp is harder than transferring a cube. Hence C is not the answer. And then we make the same consideration for opening the hand spontaneously. Opening the hand spontaneously is an easier action to accomplish than transferring an object, as shown here by placing it prior to transferring an object in the level of difficulty scale. Hence A is not the answer. The answer is D. So you go back to the question and choose D. D is the correct choice. The purpose of the next question, you will see, is to reinforce the fact that in this type of questions, those with the milestones in the choice section of the question, the only important information you need to extract from the stem of the question is whether you need to look for the easiest or the hardest to perform action, and that you do so by looking for the words able or able except. So let's work on this question. The first step is to arrange each milestone according to the appropriate developmental area. In this question, since we're dealing with the same milestones as in the last question, we know that all the milestones are in the fine motor area. So we will bypass the analysis of each milestone and just show you its conclusion, as you can see in this frame. The second step in this situation is to decide whether we need to select the easiest or the hardest action to perform. So we look at the stem of the question by passing all the writing in red and just focus on the word able, not followed by except, as you can see here. So since the stem of the question has just the word able, you need to find the easiest action. You then judge the level of difficulty of all the choices in relation to the first choice, as we did for the last question. Writing with a crayon and using pincer grasps are harder than transferring a cube, but opening the hand is easier. So the answer to this question is D. In this frame, you can look at the two prior questions. Noted that the only important information in the stem of the question is able. Spending the time figuring out the sleep schedule of infants at different ages is a waste of time, as it is considering the age in the first question. So we have looked at two examples of questions with just able in the stem. Now I'd like to present to you one question with able except in the stem. Here you have one of these questions. Notice that I am using the same milestones as in the prior question. So first, arrange each milestone according to the appropriate developmental area. As you know, all the milestones in this question are in the fine motor area. So since this is an able except question, we need to select the hardest to perform milestone. We again choose the first option, A, and compare it with the second option. Writing with a crayon is harder than transferring an object. So A is not the answer. Then we use B and compare it with C. Pincer grasp is easier than writing with a crayon. So C is not the answer. Then we compare opening hand spontaneously with writing with a crayon. Opening the hand spontaneously is easier. Hence D is not the answer. The answer is B. So the answer to this question is B. Now I like to bring a new twist to the same type of question. In the questions we have so far used, all milestones were in one area of development, the fine motor area. Now I want to introduce a question with choices in different areas of development. This is such a question. The stem of this question reads, a 9-month-old infant should be able to do all the following except. As you can see, the stem is the same as in the last question, but the choices are different. In this question, when we take the first step, that is arranging each milestone according to the appropriate developmental area, we find that, as we have just stated when addressing the purpose of this question, all milestones correspond to different developmental areas. Show likes and dislikes, as you can see, corresponds to the social skill area. Draw a line with a crayon, as you can see, corresponds to fine motor area. Stand from a sitting position corresponds to gross motor area. And cooing and laughing belongs to the language area. In the presence of this situation, we must change all milestones to the same developmental area. The choice of developmental area to which all other milestones should be converted to is chosen differently depending on the number of milestones in a particular area. If most milestones are in a given area, then all other milestones are converted to the prevalent area. If, as in this case, all milestones fall in different areas, then use the fine motor area as the axis and convert all milestones to the fine motor area. Hence, showing likes and dislikes other than by crying converted to fine motor area corresponds to transferring. Standing up converted to fine motor area corresponds to using pincer grasp. And coos and laugh converted to the fine motor area corresponds to hand opening. We then go back to the question and look at the stem to find out what we need to select. Since in this question we find the word able and except as indicated here, we need to look for the hardest to accomplish milestone. So as we did before, we choose the first option, option A, and compare it with the second option. Writing with a crayon is harder than transferring an object, so A is not the answer. Then we use B and compare it to C. Pincer grasp is easier than writing with a crayon, so C is not the answer. Then we compare opening the hands spontaneously with writing with a crayon. Opening the hand spontaneously is easier. Hence, D is not the answer. The answer is B. So we go back to the question and choose B. With this fourth example question, I hope you get the gist of how to manage multiple choice questions with milestones in the choice section. Now we will address the approach to developmental questions with milestones in the stem of the question. And here you have such a question. The first step is the same as for questions with milestone in the choice section, to arrange the milestones according to the area of development. So we choose the first milestone, pull to stand, and ask ourselves what developmental area it belongs to. And as we know, this milestone belongs to the gross motor area. Then we go to the next milestone, stack 6 cubes. This milestone belongs to the fine motor area column. Next, we go to the third milestone, saying 6 meaningful words. Using 6 meaningful words corresponds to the language developmental area. Since, as you can see, they are all in different developmental areas, the next step is to arrange them in the same developmental area. Usually, we do this by choosing the developmental area with more milestones as the axis, in order to work with as few factors as possible. But when there is no clear winner, as I told you before, it's best to use fine motor area development as the axis. So pulling to a standing position translate to using pincer grasp. Using 6 words translate to using a spoon to eat. Now that they are all in the fine motor area column, we need to ask ourselves, what should we do? And their answer is always the same. Find the hardest to perform milestone. So we draw a line arrow indicating progressive degree of difficulty to compare the first milestone in the fine motor column, that is stacking 6, with using pincer grasp. Using pincer grasp is easier, so using pincer grasp can be disregarded. We do the same with using a spoon to feed by self, which again, using a spoon is easier, hence feeding by self, the development equivalent of saying 6 meaningful words, is disregarded. So this question, from having to consider 3 factors in the stem, goes to having to consider only 1 factor, that is 1 milestone. This reduction makes the question easier to answer. By remembering that, as represented in this anchoring milestone, building a tower of 6 cubes is first accomplished by 24 months. So the answer to this question is C. Now I like to bring another twist to the same type of question. This is the question we have used in the last example. This twist consists of adding a negative action, that is, a milestone that the patient is unable to do. In this case, as you can see, we have added but is unable to play hopscotch. This twist is easily resolved by disregarding the negative action. This is what we refer to as a detractor. Once the negative action is disregarded, the question is the same as the one we used previously. So the answer is C. I want to, at this point, bring another twist. This twist relates to the approach of a similar question, but with the hardest milestone being one of the converted to the access milestone. I will explain myself. In this question, which is the last question we use, the hardest milestone did not need to be converted, as you can recall. But let's look at a variation of this question. And the variation consists of being presented with a question that, instead of having been able to say 6 meaningful words as a milestone in the stem of the question, has been able to say 900 meaningful words. So we go through the usual steps related to this type of questions. That is, we first arrange each milestone according to the appropriate area of development. Second step, we convert them all to the same area, if they are not so to begin with, and then find the hardest. So this is the product of the first step. As you can see, all milestones are in different developmental areas. This is the product of the second step. As you can see, all milestones are in the fine motor developmental area. And this is the product of the third step, which allows to visualize that stacking 9 cubes is harder than using pincer grasp and stacking 6 cubes. So now what you need to know is the stacking of 9 cubes, which is first accomplished at 36 months of age. So the answer to this question is D. You do not need to modify the stem of the question by writing the corresponding fine motor area of development. Now we go back to the types of developmental question chart to address true and false questions. True and false question can be of 2 subtypes. The first subtype is single action. The true and false single action questions are very simple. They consist of an age or an age equivalent and an action. This is an example of such a question. The odds of you choosing the correct answer is 50-50, and no specific approach helps you to be in the right 50. To be in the right 50, the only thing you can do is to learn the anchoring milestone. Learn as much as you can from this talk and pray. The second type of true and false questions is called multiple actions questions. As you can see in this question, there is 1 action, 2 actions, and 3 actions. That is 3 milestones. This is an example of multiple actions, true and false questions. These questions are approached as we did for multiple choice question when the milestones are in the stem of the question. The first step is to arrange each milestone according to the appropriate developmental area. So I have done in this frame. Notice that the area of development most represented is the gross motor area. So in this case, the process of changing all milestones to a single area of development is accomplished by converting the language area milestone to a gross motor milestone equivalent, as is being illustrated here in this frame. The next step is to choose the hardest milestone, as depicted here. So this true and false multiple action question has now become a single action question. And to answer this question, you need to remember the gross motor anchoring milestones shown in this frame, which I am bringing them back to remind you that pulling by self to standing does not occur until 9 months of age. Hence, the answer to this question is false. I like to end this long talk by bringing together the 3 steps needed in a single frame, as you can see here. The first step is memorizing the few anchoring developmental milestones and using them as nodal points to calculate the relative age of other milestones. The second step is to use chronology. To use chronology to arrange developmental milestones in the order they are attained by most normal individuals. And the third step is to plan for the different type of developmental questions. Thank you very much for your attention.